Hello, my name is Kalia Hill. I am a student at Regent University in Nursing Informatics course. I will be talking about continuous glucose monitoring systems today. The health issue that continuous glucose monitoring handles is diabetes mellitus, which is a metabolic disease that involves inappropriately elevated blood glucose levels. There are different types of diabetes, primarily type 1 and type 2, and they occur in the body differently. Type 1 is destruction of beta cells in the pancreas, and type 2 is an imbalance between insulin levels and insulin sensitivity. To manage diabetes, people have to check their blood glucose often. Some do it daily, some do it more often. In the hospital, sometimes it is done hourly, depending on the circumstances. In order to get blood glucose, it requires usually a finger stick. In the hospital, they draw blood. In either circumstance, this is an invasive procedure. People have been trying to figure out how to manage diabetes since the mid-1800s. The first attempts were found with quantifying the amount of glucose on urine. In 1908, Benedict found a faster way by using a copper reagent to test the amount of glucose present in the urine. It continued to be studied, and Ames developed the first blood glucose test strip in 1965. The same company that Ames worked for continued to work on testing of blood glucose, and they developed their first blood glucose meter in 1980. And then it continued to be studied, and in 1999, the first continuous glucose monitor, which was the GlucoWatch, was developed in 1999. However, the late 1980s, 1990s, and early 2000s saw a lot of changes in glucose monitoring, again, which is now the continuous glucose monitor. But during that time, there were different things that happened, like the blood removal step was eliminated, small amounts of blood were required, electrical chemical strips were developed, wider ranges of hematocrit were permitted, and new enzymatic tests were used. Lancets were also improved to not hurt as much. Glucose monitoring is still being studied, and they're trying to improve ways to do the glucose monitoring. And in 2016, the Freestyle Libre Pro was developed. This was the first professional continuous glucose monitor that required no finger stick testing during wear. It also is unique in that the sensor can be worn for 14 days. Since then, Freestyle Libre has developed the 14-day flash glucose monitoring system, which is for use in people age 18 and older, and then the Freestyle Libre 2 and Freestyle Libre 3 that can be used for ages 4 and older. In order to be able to monitor your diabetes, again, you have to monitor your glucose. So that's the first thing that needs to be done. You have to know how to test your glucose. Again, the first step is with a finger stick on a finger stick meter with the testing strip. Once that is done, if doctors order it, they can have the continuous glucose monitoring system. Again, with that, doctors and nurses need to be trained on how to use that. And then they can train the patients. Training of patients may begin in the hospital or at home. If in the hospital, nurses and the physicians will be training the patient. I work in a home health agency, and that requires me to teach people on how to use the continuous glucose monitoring system. And then there's the different types of equipment. Depending on what the patient has, it comes with a sensor and or sensor applicator. These have directions on how and where they can be applied. A disposable sensor is inserted under the skin of your arm or stomach, covered by a patch. Also within the patch is the transmitter that sends the information to a software program either on a smartphone, an insulin pump, or on a receiver. Then there's the app. Again, the transmitter sends this information to the app on your smartphone. So you have to understand how to use the app in order to set it up to work. What value does this technology provide to patient care? The main one is no pain. People are tired of having to stick their fingers, and this does not require that at all. Second value is it's real time. You can send and display information to your smartphone or receiver automatically. It sees your blood glucose levels in real time. Well, seeing your blood glucose levels in real time can help you make more informed decisions about the food and beverages you consume, the physical activity you do, and the medicines you take. Continuous monitoring. It's always on because it is always attached to you, either on your arm or on your stomach, and it's continuously monitoring. It monitors every 5, 10, or 15 minutes, and all you have to do is look on your phone to see what your glucose level is at the time. Again, the information is on a smartphone or device. It can also be downloaded to a computer. Therefore, your trends and your data is right there. It's easily to see. There's also alarms for hyperglycemia and hypoglycemia, which are really important, especially for people who are uncontrolled and need either changes in the medication or better advice on what they're eating. All of this together helps prevent diabetic complications because your blood glucose levels are now in good levels. And the advantages of continuous glucose monitoring is the same. You don't have the finger sticks. You see your glucose levels. It's continuously monitoring. These are all values and advantages to our health, personally and as a population. So now the disadvantages. The first major one is cost. This is an expensive system, and unfortunately, not all insurances carry it. Medicare itself has strict guidelines on who is considered reasonable, medically reasonable and necessary in order to get this. Mainly, they definitely have to have diabetes. They are treated by insulin with 3 or more daily administrations of insulin, either by shots or a continuous subcutaneous pump. The insulin treatment regimen requires frequent adjustment on the basis of their testing results, and within 6 months prior to ordering a monitor, the treating practitioner has to have an in-person visit with the patient to evaluate their diabetes control, to make sure those first 3 criteria are met, and then routine recommended follow-up care is expected. That was just with Medicare. People with Medicaid even have an even lower opportunity to have continuous glucose monitoring covered. As you can see by the slide, the people with commercial insurance were the highest people to have or be able to get this continuous glucose monitoring, and it was the same at any age. People with Medicaid had much lower chance of getting continuous glucose monitoring covered. More disadvantages is that you still could probably have to inject insulin, which is a stick, but that will control your blood glucose. And or you still may have to take a pill. But at the same time, your diet may be more regulated. Therefore, your insulin or your pill dosages may change. Another disadvantage is that there's possible skin irritation. It is something that is being put onto your body. It's like almost like a sticker. So your skin may not like that presence on your body. There's also a foreign body response, which is something that your body automatically may do if they notice that there's something within it that is not normal. And your body might reject having that device on your body. Another disadvantage is the one-size-fits-all approach, which means not everybody is the same. So it may not work as well for older people, younger people, different weights, and different other circumstances. There are other disadvantages. So there is a time delay between if you did a blood measurement and the sensor measurement, because it does take a minute for the sensor to send the information to the app. So if blood glucoses are changing rapidly, you may not know in time. Another disadvantage is it can still require that finger stick in order to just make sure that it's reading your blood glucose accurately. Another disadvantage is it can't be exposed to radiation. So if you are getting a medical procedure like an MRI, you will have to take off that device. And that may not be good if you just put it on, and these systems cost a lot of money. Another disadvantage is some people aren't tech savvy, so they might require a lot of explanation in order to figure out how to use the app. Another disadvantage is there's no ability for the user to calibrate the system. If it is malfunctioning or you're not sure, it's basically you have to get a new device sent by the company. And then some people don't want to use continuous implanted devices. They don't want something stuck to their body at all times. Legal and ethical considerations. So one of the major disadvantages that I mentioned was cost. And I mentioned how with Medicare, there's a lot of criteria that are needed in order for it to be covered, and showed you the graph showing how Medicaid coverage is very low in comparison to people with commercial insurance. And because of that, studies have shown that like the poor, older, Black and brown Americans and Americans on Medicaid have less access to continuous glucose monitors. And then insulin-dependent children younger than 18 who have diabetes are significantly more likely to get a continuous glucose monitor than people with diabetes between the ages of 45 and 64. And that was also seen on the graph previously shown. The system is not intended to provide treatment decisions also. This is an ethical consideration that we've spoken about in class, because the doctors and the patients have to be aware. If the medication or insulin dosages are not right, we need to follow up with each other, with the doctor and the patient, in order to figure out what would be a good dosage of medication to take. This graphic is from the American Diabetic Association from 2022, and it shows Medicaid utilization in America. And you can see that Medicaid utilization of CGMs is consistently highest in the West, North Central, and New England states, such as North Dakota, Minnesota, Illinois, Delaware, Vermont, New Hampshire, and Connecticut. And utilization of CGMs across all payers is the highest in Minnesota and North Dakota. But coincidentally, diabetes prevalence is the lowest in the Midwest and in the Northeast. So they're getting more care, and therefore their diabetes levels are lower. Similarly, data show that people with diabetes covered by Medicaid living in poorer states are less likely to have a continuous glucose monitor. Medicaid utilization of CGMs is consistently lowest in the Southeast. The Southeast has some of the lowest rates of CGM coverage through Medicaid in the country, including Texas, Arkansas, Louisiana, Mississippi, Alabama, and South Carolina. They all have state poverty rates higher than the national average of 11.4%. And all states in this region have a diabetes mortality rate greater than 20%. Again, it shows that people who are more low income or Black or brown are not having access to this technology. In terms of privacy and confidentiality, the main thing that can be at risk is the app, the Libre Link app. This is a secure cloud-based data repository, and it is the patient's responsibility to limit only needed information on the app. It's also the patient's responsibility to limit access to their phone or app if they have this app downloaded. And they also need to limit whom to share the data with, which you can do with that app. In terms of what is the company's responsibility, they have to keep the app secure. They have to be monitoring how it is being used by people and keep away from any hackers that may want to get into their system. They also have to be able to notify patients and or physicians regarding downtime and their need to do manual glucose monitoring at those times. So despite all of the disadvantages, the Freestyle Libre system is a really great system. It is helping people lower their diabetes mortality and complication risk. It needs to be shared widely. The cost definitely needs to come down, and it needs to be covered by more insurances, especially Medicaid, because it has also been shown that people with within more of the poverty guidelines have the poorer health, including diabetes. So this system needs to be more widely available. I believe this system was a godsend. This is making people aware of life-improving decisions by being able to see what is going on in their bodies. So, as 1 Samuel 25:6 states, say to him, long life to you, good health to you and your household, and good health to all that is yours. With the Freestyle Libre system, people can have long life because their internal body system is being managed well. Does this technology go against biblical teachings? I don't think so. The Lord wants us to live a long life. The only thing that God would like this system to be able to do is be available to more people that need the technology. Thank you for listening to my presentation. I hope you learned a lot about continuous glucose monitoring. And if you have any questions, please do so in the discussion. Thank you.